Over the past generation, we have seen that women have made progress in the workplace. However, there's still a lot of work to be done. As we celebrate this International Women's Day, we continue to strive for advocating equity and inclusion in the workplace. We continue to strive to remove bias, discrimination, and any stereotypes across all industries. My name is Bulabo Mahekeno from HEBO Consult, which is a project management training and consulting firm that works with different professionals across a range of industries to advocate for project management practices and global standard certifications. Today I'll be speaking with Dr. Neema Machumu, who is a medical practitioner. She is a medical doctor and a public health specialist. She works with MDH, which is Management and Development for Health. This is an organization that advocates for medical health practices, better services, and preventive health services. So welcome, Dr. Neema.
Thank you so much.
Dr. Neema, would love to hear about your journey as a medical health practitioner. What made you decide to pursue a career in healthcare?
My journey began in secondary school, where I had passion in biology, and I was doing pretty well in it as well. So later I went to high school, where I did PCB, and I was doing pretty well as well because I really liked the subjects. And after that, I had to join medical school at Mumbele University of Health and Allied Sciences. And what kept me going, because it's a bit tough, it's a program for 5 years. Later on, you're supposed to go for internship. So it's a bit challenging because, there's so many, you have to spend a lot of time in medical school before starting to work. So what kept me going is during that time I was there, you keep seeing patients coming in very sick and leaving the hospital with good health. So that kept me going because, I know when I become a medical doctor, I'll be making other people's lives better. I'll be creating a health community. So that really kept me going. So after graduating, I joined my internship program at Buganda Medical Center. I did for 1 year, completed in 2017. And so after that, it took me a while before I got hired. So I was trying to apply in several hospitals, but unfortunately I never got a chance. So then I thought, like, why shouldn't I think considering the public health unit. So I opted to apply in several projects. Fortunately, I got a job at MDH, where I've been working in the projects related to HIV, TB, malaria, family planning, and cervical cancer screening for women as well. So I've been working with them for 4.5 years. It's been inspiring for me to keep on working with these people because I know right now I'm working in a public health unit, so I've been creating awareness to people related to, in health-related issues, and as well I've been making sure that services are being provided in a quality standard manner, because like majority of the providers tend to provide services not on the quality standards. So making sure that we supervise and mentor them on good provision of services to the population. Yes. So, and the programs as well have been, despite the fact that we've been working on the health facility part, we've also been working in the community as well, making sure that we create awareness through the community healthcare workers or the community-based health service providers, in making sure people are aware and they seek health earlier. We call it early health seeking behavior. So in that way, we know in the near future we'll create a very good community which is healthy.
Very good, Dr. Neema. Very inspirational work you're doing. Health is a big aspect when it comes to livelihood, and it's something that is affecting all humans.
Yes.
Tell me, what are some of the challenges that you face on ground especially on the projects that you work on community projects. You've mentioned some very sensitive projects, HIV projects, mentioned quite a few,
Yeah.
which you're basically dealing with the community. You're dealing with service providers who are providing these services. You're sensitizing the community as well. What challenges do you see women facing out there?
Okay. We know, despite the fact that so many campaigns are going on in the terms of either gender-related campaigns, talking about inequalities, um, um, discrimination, violences related to gender. It's still a challenge in our field. It's still a challenge. I would say, for example, there are situations where men would not allow it to be led by women. I mean, if a woman is given a certain department, some men will come and say, I cannot be led by a woman. I cannot allow myself being led by a woman. I am more capable than her. Why would she get the opportunity to be led by me? So that's a bit challenging as well. We do face such kinds of challenges. And also, because we know, like, sometimes it's the perception, it's like a stereotype, like a young person cannot give an opinion, a young person cannot perform certain tasks. So you find maybe in the facility, maybe you go and provide maybe mentorship, or you go and capacitate the providers. If you try to capacitate a provider who is elder than you, it will be very tough, because they perceive that she's so young, she cannot tell me anything. So that's a challenge, even for, especially if you're a woman. Yes, especially if you're a woman, because we know we have these stereotypes like, she's younger than me, and sometimes they would even listen to men who are younger as compared to a woman who is younger. So yeah, that's a challenge. And another thing is that in medical related field, there are some of the careers, I would say there's some of the departments that are not to be believed that a woman could run. Let's say they're orthopedic surgeons. People don't believe women can be orthopedic surgeons because it's a tough work and all. So if you're one, or you want to pursue one, people will be like, why would you do that? You're not a man. But there are women who pursue that, and there are women out there who are orthopedic surgeons. So there are challenges of that kind, yeah, in my field.
What are the few things that you do to deal with those challenges to get by?
Okay, so they're just normal random strategies. Like, we keep on educating people, creating awareness that these things are possible, because we have real life examples of people who are possibly good leaders and who are women, and they're doing great things out there. And we also have good women who are doctors, who are orthopedic surgeons out there, and they're doing great things. People who are young, and they're doing particularly good, very good things. Okay. So it's a matter of creating awareness, and this should begin at individual level, because it usually begins with you. So if you do not do it and lead by an example, nobody else will do it. Yeah. So we keep on doing that more often. There are tasks, there are actually activities that we do at the office level, and sometimes we do it at the community levels on those special days like World AIDS Day, gender-based violence week. We usually have a week that, yeah, so we do those kinds of awareness, to create awareness to the people, starting at the office level and going out to the facility and the community level that way. So I believe as time goes on, people get to be aware of these things, and I'm sure eventually it will just go down. Yeah.
I agree with you. Yeah,
Yes.
I definitely agree. The work that you're doing in sensitizing the health providers, but also sensitizing the community, is definitely a good approach, and it's surely needed, because there is that stereotype, but someone has to break it. It's got to start from somewhere.
Exactly.
Speaking of that, the projects that you are undertaking, the medical projects that you are, leading, you're managing as well, I see that they are mostly they are mostly community-based, where you deal with the communities per se, because
Yeah.
you're sensitizing health providers, but you're also actually going on ground to sensitize communities. I assume most of these, a big percentage of these communities that you serve include women.
Yeah.
What are some of the issues that these women face that maybe you can share? Some of the challenges of the, the population that you serve in the different districts where you sensitize communities on health issues.
So there are several challenges that we see, we observe during the time in the field. Particularly if you have a HIV client, okay, for example, because we deal with HIV programs as well. So if you have a HIV client, we tend to seek their sexual partners. We tend to seek the biological children so that we can cut the transmission, the chain of transmission. So in that manner, there are several ways to reach those contacts. It's either the client herself or himself brings the contact at the facility for testing and counseling, or you opt to go, you as the provider, after consulting the client, or either both of you, the provider and the client, you both go and seek for that contact for testing and counseling. So sometimes you get a challenge where the client tends not to disclose to the sexual partner, or so the failure of disclosure, it's either due to behind the scene intimate partner violence, so they're scared to open up to that partner. Maybe they'll be beaten up or even being hurt emotionally. So this becomes very tough in our field. So women do face this. And we can see it. Some do also, they agree to open up to us and tell us that, you know what, I can open up to you about that person, but I'm scared. If he finds out that it's me who laid you to him, I'll get in trouble. So those things are there. But also, there are some communities which restrict women to come and seek health at the facility. So women tend to stay with their problems, their diseases, until they get to be advanced. That's when they come, which is very, very bad.
Right.
So those kinds of stereotypes too also are there. The discrimination part, it is also happening in the client side, in the communities. Yes.
So a lot of work still needs to be
Yeah,
done
a
to
lot of work.
sensitize the community.
Yes, yes.
And also to deal with the abuse that women go through, possibly even men, but
Yes.
would you agree that it's mostly women who
Yes.
go through this? Huh?
Yeah, I do.
The International Women's Day is breaking the bias. Yeah, this is an interesting theme, and I think very relevant, especially in your sector, in the health sector.
Yeah.
What does it mean to you when we talk about breaking the bias? What does it mean to you, and how does it apply to your field? Because we can see the imbalance, we can see the bias. How do you explain it? What would be the message that you want to send out to stakeholders as we continue to advocate for gender balance, we advocate for, a more equitable world, but also in terms of healthcare provision and distribution, and also the receivers of this healthcare? You want to talk a little bit about that?
Okay. Break the bias, I would definitely talk about it in a way that it's all about eliminating or stopping some sort of discrimination, some sort of inequalities, some sort of bias or stereotypes that are happening in our communities. And we can see this can be seen in either maybe in form of races, maybe this discrimination or stereotypes can happen in maybe in form of ethnicity, races, age,
Right.
or even gender. So And this can happen in several places. We see it in several institutions like schools, universities. We see it in offices. We even see this in families. Yeah. So I believe this is an individual thing. It begins with someone doing it to somebody else, and somebody else seeing it, and we keep the chain going on. So by breaking it, or eliminating or stopping this, it should start at an individual level, like I said earlier. So if an individual behaves in a different manner, he or she will lead by an example for the whole community to follow. And if the whole community follows, that means the whole world will follow.
Exactly.
Yeah, it will be a good picture for everyone to follow. And later on, we'll be accepting the differences people have, and we value them and celebrate them. So I would term it in that manner. Yeah.
This is a good opportunity to encourage other women as well who are aspiring to pursue a career in the medical field. You're in projects, you're implementing, you're part of different projects, healthcare based, and the impact that you're having to the community is big. For those who are watching you, for those who are looking up to you, the students maybe still in secondary school, the students in universities, and the ones who are graduating and they're pursuing careers in projects in the field that you're in, what do you want to tell them? How should they how should they pursue this journey? Any advice you want to share with them?
Okay. I would say there is a room for women to come into this field, in terms of medical field as well as public health field. There is a room because we see the ratio of men to women is still very high. I mean, like, there's so many men in this field rather than women. So we have a room for more women to come and join in this field. So women should get inspired, young girls should get inspired, and they should set the bars higher than where they've been setting. So they should get motivated, and they should believe in themselves that they can make it. There are a lot of women in this field. They should be very much inspired to know that they can also make it. And they should also be part of the breaking the chain. Yes, they should also be part of it. And I believe by doing so, they can really make it in this field. Yeah.
Very nice. Thank you for inspiring others.
Yes.
We know that it's a tough field, and it's a sensitive one as well, because you're dealing with people's lives, you're dealing with people's health. So I'm sure all those who are listening to you are actually motivated and inspired. Thank you very much, Dr. Neema.
Thank you so much.
As a project management firm, HEBO seeks to upskill and reskill professionals in all fields who are actually managing and leading projects. What I want to do is encourage all the women out there to continue to pursue your dreams, continue to upskill and diversify and manage those projects and lead your teams accordingly.